This episode of Beauty and the Surgeon podcast is brought to you by Let's Get Checked. Let's Get Checked is an online company dedicated to making professional health testing easy and accessible. Let's Get Checked offers fast, affordable, completely confidential at-home health tests from a range of tests from STDs, male and female hormones, and even COVID-19. Listeners of our podcast who are new to Let's Get Checked get 20% off by using our URL, trylgc.com/beauty, and be sure to use the code BEAUTY20 at checkout. That's trylgc.com, trylgc.com/beauty, BEAUTY, and be sure to use the code BEAUTY20, BEAUTY20 at checkout. Do it. Getting tested is important. It's the responsible thing to do, and you know how important I think it is to make sure you understand your labs. Welcome, everyone, to Beauty and the Surgeon podcast. I'm Amy. I'm a nutritional therapy practitioner, and I'm joined today, as always, by the iridescent Dr. Jason Martin. He felt like he wanted to be very bright today, so Nils has him super bright.
I want to be as bright as possible.
You want to be bright.
I mean, it's post-Valentine's Day, you know?
You got that glow.
I got that glow, that loving glow.
Yes. Well, if you are listening to this podcast and you're interested in following us or watching us on YouTube, you can find us at Jason Martin MD.
You can see my glow.
We're at Beauty and the Surgeon podcast.
You can also see our tea mugs that we have every single time, our Beauty and the Surgeon tea mugs.
Mm-hmm. Yes.
I do green tea every time. What do you do, Amy?
I do green tea most of the time, but now I'm on water because it's later in the day and I don't want to be awake all night.
I can take the caffeine. What time is it? It's not too late, right?
There is no time on the internet.
Okay. That's true. It's timeless.
It's timeless. It's no time at all.
Who knows?
Yeah.
This could be day or night.
Yeah,
this could be 3 in the morning.
This room has no windows. I don't know what time it is.
It's like Santa Claus.
Yes.
Like, where is Santa Claus? I don't know.
Who knows?
Some time zone.
Mm-hmm. He's out there.
He's out there.
Yes. So we have a great topic today. We're talking about breast implant exchange. We've talked a lot about breast implants on our podcast. Recently, we talked about the new FDA requirements around the black box warning on breast implants. But today, I kind of wanted to, we've talked about implant exchange all the time, but we kind of just brush it off like, oh, implant exchange. Like, let's just talk about implant exchange only.
Implant exchange actually can be really complicated.
Mm-hmm.
Unfortunately for our practice, we get a lot of people referred to us and they've already had breast augmentation, not by me. And going in trying to make things better and put a new implant in, usually downsize, all these kind of things, is kind of gets complicated. This is a really interesting topic and actually very, very useful for anyone considering the surgery. Yeah,
anytime you've had surgery in an area and you're having surgery again, it complicates things. So implant exchange is no different.
Right.
Even if it's a very standard breast implant exchange, it's still different than the first time around.
Right.
Yeah, so it's different.
That's a good topic. It's really, I'm surprised we haven't done this as a standalone.
Yeah, so let's, I love to start off these procedure episodes talking about statistics.
Yeah.
However, there are no statistics for implant exchange from ASPS.
What?
There are, so what I had Sarah pull was the augmentation and removals, both. So we could kind of see what those numbers are like.
So you think the implant exchange is in augmentation, maybe?
I know it is. It has to be.
Yeah.
There's nowhere else it could be.
Because it's like Tom Hanks in that movie when he's in the airport and like he loses his country. Like there's nowhere for him to go.
Yeah, he has no passport, nowhere for him to go.
That's like implant exchange.
Yeah, and I was actually really surprised by that. And it then makes you wonder, well, then what are the real numbers of implant exchange? I mean, if there were, in 2020, there were about 36,000 women who had their implants removed. And this is cosmetic. These are not insurance related. So these are not the reconstruction. There are different ones for those. So, around 36,000 people just had their implants taken out. And in total, there were around 193,000 breast augmentations done. But how many of those were revision augmentations or implant exchanges or other things? We have no idea.
That's weird.
There's no data. Yeah, that's why That's why I always say.
I didn't do any research on that. I'm just really surprised by that. Are you sure that's correct? Do you feel very confident on that?
I am confident that it is not on the list of surgeries that ASPS tracks.
Well, then there you go.
So
what are we going to do?
Yeah, I mean, I don't know what you're getting at here. Do you think I am unable to read and so is Sarah? Like, oh, there's implant exchange. We just can't with the eye. I don't know.
No, you can definitely read. The pronunciation part is a little off with you. Sarah's got good pronunciation.
Yeah, so I would trust Sarah to be my backup.
Yeah, that's good.
Yeah.
No, I'm just surprised. I'm surprised they don't have that.
I was too. Yeah, so who knows how many of these augmentations were actually exchanges. We don't have specific numbers on that, so I don't know. But I do know that 36,000-ish people had their implants taken out in 2020 and 193,000 people had them put in and or taken out and put in.
There you go.
Yeah, so statistics. This is my favorite thing with breast implants. Do my implants have an expiration date? I call this the 10-year myth. How did this myth get started, Dr. Martin?
I don't know. We have food products and they always over time go bad. So I think you get into that. Like you got to check the cheese drawer to make sure you don't have mold on your cheese.
Right. Rotate your tires. I've heard people say that with their implants. Like it's like rotating the tires.
Rotating the tires. Yeah.
And
appliances don't seem to last long anymore. You know, in the old days, like they have like refrigerators that, I remember my parents' house. My parents have like a refrigerator that was like 20 years old.
It's because they used Freon back then.
Is that what it was?
Yeah. They're terrible for the environment. That's why.
But at least they had a refrigerator for 20 years.
Oh yeah, the refrigerator. It's like the freezers, those chest freezers. We had a chest freezer when I was a kid that I'm pretty sure was from like 1940. Yeah. It was metal. Then kept stuff frozen solid.
So, I get that. Like, anything physical we know expires at some point. And we do say, at the behest of the FDA, that, you should expect that if you do breast augmentation, you will need surgery in the future. They do say that you can expect, on average, something like 10 years out of the surgery. But it's not like pre-programmed into the implant itself.
No, and this is an old statistic. This 10-year myth is from old numbers. It's not even from current breast augmentation numbers. True. So this is from numbers from like the late 90s of when along the string of time that women were tending to have other surgeries. And I think this did a disservice to people for many reasons. I think that it made them think that they wouldn't need surgery for 10 years. Or that they would magically at 10 years have to have surgery. Like I've gotten a number of calls from women who are like, well, I've had implants 10 years ago.
It should be easier on a business. We could just schedule everyone 10 years in advance.
Yeah. Like I need to have my implants exchanged. Clearly. I'm like, well, are they fine? Are they soft? Do you have any issues? Like, nope. Well, then you should leave them alone.
Right.
So other people though, as we've talked about in some of our episodes about breast augmentation, you might need surgery again within a year of having your breast augmentation done. So there is no such thing as an expiration date on your implants.
Nope.
Now they do have one when they're in the box, because all sterile products have an expiration date that is, I don't even know where that comes from either, arbitrary, but how long they're sterile for in the box. But once they're inside you, there is no expiration date. They don't magically fail at 10 years. You don't have to have them exchanged at any point in time.
It's not like an Apple iPhone, you get it for every 2 years. It's going to have some sort of problem. Oh, I need to upgrade.
Yeah, It'll just become annoyingly ineffective. Yes.
And I happily do. So does Nils.
I do not.
We should do an episode on that.
Apple products and the psychology around them and like the psychopathology around people who use eye products.
Okay. I'm not arguing with you, but you're not totally normal either.
No,
okay?
But I haven't bitten the apple.
Okay. Well, yeah, I can tell you some things you have. All right, go ahead.
I got lots. So why then would someone need or want an implant exchange? If they don't expire and your implants aren't going to just suddenly fail at 10 years, then why does anybody get their implants exchanged?
Well, the first thing that comes to mind is the breast gets hard or asymmetry. You get capsular contracture, things that affect the way that it feels or looks. A lot of people want to go smaller or bigger. Just over time, your body changes. That's another reason we see, like, you say you had pregnancy, or say you had breast augmentation in your 20s, and then you were pregnant, your breasts get asymmetric or sagging after breastfeeding. Those are the big reasons. Every now and then we get people with failed implants, ruptured implants. These new mammograms actually can find these failed implants a lot better. That wasn't the case like 5 years ago. So these 3D digital mammograms that they're doing are a lot better, at least for the radiologist when they read them, to say, hey, I think this implant's ruptured.
Yeah, they have a better ability to perceive the difference between tissue and
I didn't
silicone.
Look down. Okay. And then injury is, Amy has on here, which is, we've seen this a lot in our practice, but maybe that's because we have higher volumes. People getting in car wrecks with the seatbelt that comes over their shoulder really puts a lot of pressure on those implants, and you can get a rupture there. And these are talking about or skiing. Yeah,
I was going to say that it's rare that there's a rupture related to an injury. Like that takes a pretty intense injury. I mean, usually I always tell people like the type of injury that would happen that's strong enough to rupture your implant would also be strong enough to break your bones.
Yeah.
So,
a bad car wreck is like that.
It is, but even in those cases, like sometimes you might be in a really bad car wreck and you have soft tissue damage, and then that bleeding around the implant is not good, and you have to go in there and evacuate the hematoma. That is actually something that they found a much higher incidence of capsular contracture in people who have hematoma or postoperative bleeding, and they think that part of the reason that might be is because there's just all of this as we've talked about in previous episodes about healing, the intense amount of like matrix that comes to a healing area can bring with it a lot of other things. And they think that that might contribute to the biofilm production and all this other stuff. So if you have bleeding around your breast and you have implants, your surgeon will likely want to exchange that implant to prevent you from getting a capsular contracture on that side, even if your implant's intact.
There was a patient we had one time, very nice patient. She had a hematoma after surgery and the surgeon did not evacuate it, and it was a disaster.
Yep. Yeah.
So she presented to me maybe a year after that, and it was just really difficult. I had to go clean everything out when I was doing the implant exchange. It was a very difficult surgery.
Yeah. Well, just leaving a hematoma in any part of the body without evacuating it, your body can build a capsule around it, and then you have that additionally around your breast, like not a good situation. So if you have bleeding, even right after surgery, if you have a hematoma, you'll likely have the implant will be exchanged as part of dealing with the hematoma.
Right.
So even if your implant's not ruptured, there might be injury reasons that necessitate an exchange of your implant. Breast lift is another one. You have implants and you want your breast lifted. Well, you might as well, especially if you have saline implants that are old, changing out the size or changing out the implant to a higher quality implant when you get a breast lift is pretty common. Most surgeons are going to want to do that. Even for us, if someone has implants that are, more than 5 to 10 years old and they're getting a lift, we'll probably encourage them just to get new implants. Why not? You're already doing breast surgery.
Yeah, you're already there.
It's good timing. You're there.
And then you can like dial in the size and projection on the implant for the lift itself.
Yep. And getting them into like maybe a better, newer generation of implants, a more cohesive gel. Like there's a lot of reasons. And you're having surgery on your breasts anyway. And that's, where I said before, like there's no need to like at 10 years get your implants exchanged. But if you're having breast surgery anyway, or you're having a hematoma evacuated, it's a good time you're in there, change out your implants.
Exactly.
Yeah. Pregnancies, normal breast aging, size change, all those things. You might want an exchange.
Yep.
Yeah. So who's a candidate?
I guess if you have implants?
Yes.
Okay, there you
go. Any woman
I didn't know
with
this was a
breast
trick
implants.
question.
No, this is not a trick
I got a little
question.
nervous there for a question.
I know,
was like,
right?
Whoa.
Like, who's a candidate?
No, if you have implants and
you're healthy enough for surgery.
And you have an indication.
Yeah.
So if your implants are soft, they're symmetrical, you like the size, you like the projection, there's no reason to do surgery.
Nope. 10 years or not, you're leaving.
But if you have
asymmetries,
asymmetries, your implants ruptured, you have ptosis or breast droopiness, and you need to do a lift, and you want to consider exchange at that time, capsular contracture, rupture, et cetera. There's so many different things that could occur after breast augmentation. Then obviously you're a candidate if you're healthy.
You have implants, you're a candidate. Yeah. All right. Let's take a quick break.
Well, real quick though, if you're going to do surgery, is it free, Amy?
We'll talk more about it. We will talk more about the specifics of implant
it's all free, right? You've already paid once.
Absolutely not. So let's take a quick break. Hear a word for our sponsors. Let's get checked, and we'll be back.
Let's get checked.
Dr. Martin, I'm super excited to talk about our sponsor for this podcast. Let's Get Checked. If you've been a listener of our podcast, you know that we have never had a sponsor before, and that's because we're an educational podcast. We're not looking to monetize, and we also would never recommend something that we didn't believe in and or use ourselves.
So basically you're saying we're very choosy.
We're very choosy when we come to our testing, but Let's Get Checked really aligns with our values. We talk a lot about monitoring your blood values of certain things. We talked recently about vitamin D serum levels. We talk a lot about hormone levels, and it's hard for some people to get to a lab, or you're afraid of the blood draw, or just, you're concerned about confidentiality. Like you have a lot of concerns and you just don't do it. Let's Get Checked makes it super easy because it's completely confidential. You do it from your home. So there's really no excuse not to do it.
Yeah, and we did it recently. Both Amy and I did it. She looked at her women's health, basically her hormone levels, and I looked at mine on the men's health side with testosterone. It was very simple. You go online. Their online interface is really easy to use and good. We got the testing kit very quickly. And the test itself, actually doing the stick, you do a stick on the end of your finger, is not hard to do. It only took about 3 to 4 minutes. You put it back in a sealed envelope that's confidential, goes back to them. You get your results in 2 to 5 days. It's really that simple. And the best part is it's about empowerment, about you taking control and trying to do things that are positive for your health and life. And this is one way to do it literally from the comfort of your own home.
Yeah, so they offer a wide range of tests. So they do men's and women's hormone panels. They do a full panel of STD testing. They also are now offering a COVID-19 test at home. So there are a lot of other just basic blood levels that you can get tested as well. And one of the things that we always say is you can't track what you don't check. So you might not know what's normal for you in the future if you're not checking it now, especially as it relates to hormones. And men's health specifically, I feel like is a little bit undertreated. I mean, sperm counts are dropping by a large percentage in men these days. Most men struggle at some point in their lifetime with low testosterone.
And those men do not know what the symptoms of low testosterone are. Depression, anxiety, sleep problems, osteopenia or loss of bone, loss of muscle, and something we treat all the time, gynecomastia or male breast growth. These are real problems that can be improved or treated with testosterone. And these men do not know their levels. It's so easy to get checked. And this is why we're so excited about the sponsor.
Yeah. And Let's Get Checked is a completely CLIA certified lab, the CLIA lab. So they're a well-established, completely safe lab to use. You do get contacted after, so you get your results. I got a text at 4:30 in the morning, which I loved, that my results were ready.
And we're both up at 4:30,
yep,
so that was good.
Super excited. And you have access to not only a nurse, but also a physician. So a physician does review your results, and it gives you a little breakdown of like where you're sitting on those levels. Dr. Martin's had even comparisons of like where two of the levels should be in relation to each other, which is a really important thing to note.
Right.
Just being within the normal range is not always enough. So it really gave more information than that. And you'd still want to, of course, reach out to your own doctor if you needed some additional assistance with these labs or you did see something that was concerning. We didn't, thankfully, so that was good.
Yeah. We were both good. This podcast is about empowerment. It's educational. In my private practice, I'm a board certified plastic surgeon. We are all about empowerment, and this is one way to do it. So we're very excited about the sponsorship, and we're looking forward to using it for our patients moving forward.
Yeah. So as a listener of our podcast, if you're also a new time user to Let's Get Checked, which a lot of you probably are, we do have a 20% discount code. So you do need to go to our specific URL, and it is linked in the description box below, but it's going to be TryLGC. So TRYLGC, like Let's Get Checked.com/beauty, BEAUTY. And you'll need to use the code BEAUTY20 at checkout. Beauty again is BEAUTY 220. And you can pick a test, like any test you'd like, put in our code and get your test shipped to you. Getting tested is the right thing to do. It's lets you know where you're at and what's responsible.
All right. Well, let's get tested.
Let's get tested. Let's get checked.
Let's get checked.
All right. Now that everybody has their lab work done, they're good to proceed with surgery.
Wait, yeah, you did. Let's get checked. We checked everything.
Yeah. And now let's talk more about what to expect.
Yeah.
You brought up the cost, and I think we say this on all of our podcasts where we talk about how much plastic surgery costs. Plastic surgery is elective. And just because you have something happen in your life down the line that has, impacted your breast implants, do not expect that your insurance will now cover that. They most likely will not. This is an elective procedure from the start. They will consider an elective procedure to fix, to change, to adjust, to do anything to on you.
Maybe if you have breast hypertrophy and your breasts are so large that you could somehow qualify for a reduction, but I think
they'd cover the reduction. They're not going to cover you getting implants put back in.
Exactly.
Yeah.
Yeah. So
or taken out.
Right.
Nope.
I mean, there's no way a lift's going to be covered. Some insurances will cover for implant removal in some cases, especially
only if you have rupture.
Have a rupture. Mm-hmm. But other than that, it's just not going to happen.
They will not cover the replacement of the implant, though.
And it is funny. I mean, it's not funny, but it's like you feel for patients because you understand. Like you have insurance, you think, oh, they're going to cover everything. They don't. But it's interesting how they, in their mind, come to the terms that the insurance should cover it.
No, this was elective.
Yeah,
They're also not going to cover your facelift or your tummy tuck. These things are elective. So going in elective, coming out elective. Now, insurance does, or the companies who manufacture implants do have their kind of own warranty information or warranty setups for different implants. They may cover part of the cost of the replacement of your implant if it was via rupture that was not due to a car accident or some situation like that. If your implant failed, they might cover the cost of your implant to replace, but not the OR.
Do you remember what the failure rate is for an implant? Over 10 years or 7 years? Yeah.
It's very low.
It's not that high. It's definitely less than 5%.
Yeah, I was going to say 3, but I don't know that for trues.
And I remember, maybe it was our episode, maybe we were talking to one of the reps, but they all have a little bit different warranties, like the different companies. I feel like Sientra's was the longest and Allergan's was the most comprehensive or something.
They'll give you the most money. Yeah.
The most money.
Yep.
And they're like, oh, you should tell your patients this. I was like, okay. But
I would not expect that any of it would be covered.
But sometimes they'll cover the...
What I'm saying is from a patient standpoint, as the expectation, you should expect that all of the surgeries you have on your breast for the rest of the time you have your implants are yours and yours alone to cover the cost of.
Good point.
Especially if you're just doing an implant exchange for size or for a lift or for pregnancy changes, whatever. Like that's on you.
That'd be kind of interesting if they had like a cosmetic surgery insurance policy.
They do exist, but they mostly cover complications right after. So in cases where somebody's health insurance won't cover them.
Yeah.
Because a lot of them won't. Like if you end up being hospitalized for some of the complication, listen to our previous episode that came out on February 1st about unexpected things, what to expect when the unexpected happens.
When the impossible happens.
Yes. Yeah, so you can't expect your health insurance to cover you for those conditions if you end up hospitalized for several days after a cosmetic procedure.
I got a great idea.
Okay.
So how much do you think insurance costs a month that's not health insurance, like dental insurance or something like that? Pet insurance.
I don't have a pet. You tell me, how much do you pay for your pet insurance?
I never had pet insurance.
Well, that was your first problem. You get it this time.
Okay, thanks.
Get it this time.
The knives that come in from all angles.
I'm more surprised because you are a healthcare professional and so is your wife. So I'm surprised you guys didn't have insurance.
I don't know. Yeah, we just didn't.
Because I feel like everybody does on their pets.
All right. Well, we missed that one.
Depends how old they are.
Yeah.
Yeah.
They hit an age and you can't get
Yeah. So let's just say it's like $50 a month, right? So if you get a breast augmentation, afterwards you just set up a savings account to $50 a month, call the savings account breast surgery in the future, right?
Well, that's like what I tell people who are 20 to start saving for their facelift. Same idea. Savings. It's called the savings account.
Yeah. But you can pay it every month, have a direct like payment. I mean, that's
for future surgery.
for future surgery.
Yeah. That's a good idea. There you go. So let's talk about what to expect from surgery to recovery, all that good stuff. There are a couple things that might be included in your implant exchange. It might just be a simple size change and there's really nothing else to do. Dr. Martin brought up capsule several times. So you might need a capsulectomy or capsulotomy. What is the difference there?
Ectomy means you remove it. Ectomy out. Otomy means you incise it. You otomize it.
Why would you do that?
The ectomy is what I usually do, right? Because if you have real bad scar formation, why would you leave it there? I try to get as much of it out as possible. And people want that. Now with the data we know with anaplastic large cell lymphoma, we know that that's caused around these capsules. A lot of people really want at least a subtotal capsulectomy, not a full en bloc capsulectomy. So that's a complete removal. I like to remove the stuff that causes the problem, period. An otomy means you just maybe, and I do this sometimes too, for people that have capsules where they're not really strong, I'll release them a little bit. I'll incise them and kind of do almost like a grid pattern into them.
So like stretch it.
Stretch it out. And then once you do that, then clearly you're assuming that in all these areas that scar tissues may not grow back across, but I'm sure it does.
So which seems to me the exact
I
opposite.
know.
Like I would assume it would.
Stop ruining it for everybody. I know. In my mind.
It's like a bone.
Right. I know.
Those osteoblasts.
But it does, at the very least, if it does grow across, you've expanded it out. You've kind of
softened
it a little bit.
Yeah.
You've allowed for more expansion. You want to put a bigger implant in.
Yeah, that's actually would be key. If somebody had a bad capsule and they were going to size up, you'd have to at least, if you weren't going to remove it, you'd have to at least give it room to stretch.
In real bad cases, for people that have real old implants and they have real bad capsules, I will take out the implant and the capsule together. Yeah. So it's almost like taking the soft tissue off around, we've said this before, around like an orange or a grapefruit. And the rind is the capsule, and I keep it all intact. And
like an M&M.
Yeah, and I pull everything out, and then I open up the capsule like an egg, and then you'll see the implant on the inside. And almost always in these really old implants, the implants rupture in almost all cases.
Yeah. Well, their shells were just so weak. And, I mean, if you've had that in there for 20 plus years, there can be, especially on the looser types of shell, you'd get like rubbing essentially where there was a little creasing. So even on a silicone implant, like that rubbing across those little tiny little creases and crevices.
Yeah. And that happens with the new ones too. Because I mean, you don't have to be Nils' dad, who's like a physicist engineer person, to understand that when you have a rippling shell, okay, if you're looking on the YouTube channel, the shell's going up and then ripples down like this, that area where it bends on itself is where it's going to weaken. Yeah. Just think about anything. You take a stick and go like this, ultimately it breaks. Imagine that rippling area is always moving when you're moving like this. And then over time, that's the failure areas. The funny thing is you send those back to the manufacturers and they say, well, I think it's a surgical problem.
Yeah, they always blame it on a surgical issue.
It's really good to be a big corporation with a lot of lawyers.
Which is why, again, I would tell you to expect that you will be paying for this yourself. The newer style of implants are actually really cool in that they're not completely flat on the back, and that I think has helped a lot with the more durability of implants. They're almost shaped like I say, like a UFO kind of If you watched Flight of the Navigator,
Mm.
no one who's getting a breast aug knows what that is. Great movie from the 80s, but like the UFO in that, like it's almost like it's rounded on all the sides. It's not flat on the top, flat on the bottom, and just rounded on the top. It's like rounded all the way around. It's rounded all the way around.
That's another
around the outside.
subject that you and I would win on Jeopardy is 80s and 90s movies.
Oh, 100%
And then
I would win.
Associated music with those.
Yes.
Yeah.
Oh my gosh, yes, I would crush it at 80s
Even
movies.
I would throw in movie lines.
Yeah, oh, I got all those
I just
too.
I rewatched Goonies. I mean, and I was telling my son, I was like, "This is one of the funniest movies." He's like, "Yeah, it's okay." I was like, "How could you say that, son? How could you say that?"
Oh, that is crushing. Like when your child does not see the same, like,
Right.
yeah, get the same enjoyment out of a movie that you did. Goonies was a good one.
Oh, it's so good.
Yeah. So back to the capsule. Sorry, got a little off topic there. Other things that you might have done are a breast lift or a mastopexy. So that would, happen at the same time as your implant exchange. Lift your breast up. In any case, or in most cases, it's usually less downtime and recovery when you're having a secondary breast surgery. Now, that's not always the case. If you had a subglandular breast augmentation and now you're having a submuscular breast augmentation.
That's called change of planes. When you take it from above the muscle to below, anytime you violate that muscle, it's going to hurt.
Yeah, your experience will be different.
Right? Now, but if you've already had it below the muscle and it stays below the muscle, which is usually the most common thing we do, then you shouldn't have too much pain afterwards. But if you have to rebuild that pocket, sometimes I use the capsule to rebuild it. Every now and then I'll use grafts.
Yeah, a lot of internal suturing.
A lot of suturing. That can hurt.
Yeah.
So, it's not pain-free, but it's definitely not like your first procedure.
Yeah, in most cases. And for some of our patients, I mean, when you have a simple, like we've had a few random cases of capsular contracture that happened that were just on one side within like a year of surgery. You go in, 30 minutes later, replace that implant, and they have like no pain at all.
Right.
Like literally none. Are back to work. It's very little downtime.
If you do have aggressive capsular contracture,
Totally different.
right, where it occurs within a year or two, and Amy was saying that on ASPS they said 75%.
75% occur within 2 years, which I found surprising.
Yeah, we
That's
haven't
not what we've
experienced.
seen.
Yeah, but
Yeah.
whatever. Maybe they're talking about clinically evident, pretty aggressive capsular contracture. Capsular contracture is quantifiable, and they have different clinical
Baker
levels.
grades.
The Baker grades. So, it's when you look at this data, you got to understand what they're talking about, and that sometimes can be confusing. But say if you have really aggressive capsule, I always take that entire capsule out, just so you know. Now that has a whole other set of problems associated with it. You can distort the pocket. You put a new implant in, maybe it's not going to look the same as the other side. So, it gets into a whole other kind of area that could cause asymmetry. But at the very least, you don't want that to happen again.
Right. And again, that goes back to the 10-year myth. If your implants are fine, don't mess with them. If you're not changing your implants for one of those reasons we discussed, then leave them alone, because anytime you have more surgery, you have more risks of complications
You have
and of
more
other
risks
issues.
of capsular contracture.
Yep.
Actually, the risk of capsular contracture goes up every time you have surgery.
Yes. So ironically, having surgery to treat your capsular contracture makes you more likely to have another one.
Yeah.
So all these things have risks, and that's why
We got to get back to topics that are more positive. I feel like lately we've been being way too honest with people.
well, there's a difference between honesty and positivity.
That's true. That's a good point.
Yeah, those are not the same things. So your downtime and recovery is going to obviously vary, like Dr. Moore was saying, based on your surgery. So depending on especially I think the biggest one would be a plane change. Like people who had implants above the muscle and now go below are going to have a much different experience recovery-wise because of that pain from the muscle that they didn't have the first time that they weren't expecting. Other than that, though, the recovery is generally pretty easy, especially from just a straight exchange without any of these other factors.
A lot of times in the OR, we'll inject local anesthesia into the muscle. That'll help. There's something called a PEX 1 and 2 block. There's actually an OG episode with an anesthesiologist on our, it's probably not even YouTube.
There's not a video, so you'd have to go on wherever you're listening to podcasts.
Right, and go back to
find it.
anesthesia. He talks about the PEX 1 and 2 and block. And with these newer type of local anesthesias like Expiration, you can inject it like literally in the OR. So, there are some things you can do, but it's definitely going to hurt when you go underneath the muscle no matter what. It's one of the more discomforting surgeries that we do, but it's very short-lived also.
Yeah, the pain is not long, but it's definitely more intense if that was not what you experienced the first time around.
Right.
Yeah. So we have a great picture here, and this picture is actually on our professional Instagram account. So if you go to @JasonMartinMD on Instagram, you can
Which
see
by
this
that
as well.
time, I should have a video up that shows explantation, breast lift, and fat augmentation. I know that's not about this topic, but at the very least, you'll get the idea of removing an implant. And in that video, that patient had a ruptured breast implant, and you can see what ruptured silicone actually looks like in the OR, assuming Amy's going to let me post it.
So that's not at all what this picture is showing.
No.
So this is a picture of an implant exchange. This patient had implants, decided after child, she had 2 kids, decided she wanted to just size up, super easy. She didn't need a lift, sized her up, almost doubled the implant size. And I like showing people this picture because I think people think a size change on an implant. They're like, wow, I wish I would have gone for the, 410 instead of the 405. Like that would have just changed everything. Like, no. And we tell people this, unless you are sizing up or down by 100 cc's at least, you shouldn't even do it.
Right. It's not going to make any difference.
You're not going to see any difference.
What's the difference? 200 cc difference?
This is a 200 cc difference.
Yeah. And you can, notice it, but it's not like noticeable.
No.
And the difference here is that we have the same width, or a little, pretty much the same.
Yep.
But the projection is a lot more on the after. And so you can see the difference. So it doesn't look like she has this big side boob area if you're looking on Jason Martin MD YouTube channel. And so you can see what selecting an implant is, why it's so important to select an implant that fits that pocket correctly.
Yeah. And that even 200 cc's, which might seem huge to somebody, is not that much of a difference. And that's so important to understand.
But she's not a big person either.
Nope. She's very average size. I say she's probably 5'6", 130 pounds. Like she's a very average size person. And her implants after, she's definitely in the very, very full double D category, but that's what she wanted, and she's young, and that's what she got. So if you're in your mind thinking like, wow, I think I'm going to do an implant exchange because I wish I had done a slightly different size than I am, you're chasing something that is never going to get you to where you want to be. Same thing if you size down. People who think like, wow, they're just a little too big. Could you have done the 265 instead of the 285?
It's not even a tablespoon.
It's
really.
not. You would not even notice. Like you wouldn't even notice going down to maybe a 234.
Yeah.
Like it takes a lot, and because your body kind of absorbs the implant. And I think this picture does such a great job of showing that. We kept her implant the same width. All we did was change the projection. So really, her breast looks very much the same size, but it's a lot fuller.
Yep.
And that's
what she wanted.
That's what she wanted. It was very easy to achieve. So, I think implant exchange can be awesome if you have a specific goal in mind, or you have a specific thing you're trying to achieve. Like, absolutely, it's a great surgery with minimal downtime.
So, as Amy said, increasing size or decreasing size is one of the biggest reasons, and also capsular contracture. But to decrease size, the smaller the implant, usually the more narrow the implant is. So that's where the pocket revisions come in, and that can be really hard, just so you know. So we'll have people that come in that have 600 cc implants, or maybe not that big, but something bigger, and they want to go down to a 250 or 300. That's really, really hard to do.
Especially without a breast lift.
Without a lift, and also may require grafts, which cost a lot more money, right? So that's where you get these implant exchanges that can be very, very complicated. Now, we could have a whole episode on that, and we're not going to get into the weeds on all that kind of stuff, but you need to understand that one breast implant exchange is not equivalent to the other.
Yeah, it depends on where you're starting and where you're trying to go.
The downsizing is sometimes the hardest thing to do. That's why, all you got to do is go into a plastic surgeon's office. They're probably always going to try to push you to go a little bit bigger, right? Because what they can fill out that little pocket better if you go a little bit bigger. It's always the downsizing that's more hard. But then again, the bigger is also hard too. If you're narrow chested and you have a small implant in that's very narrow, and you want to go 300 cc's bigger, you may not be able to, in a natural way, fit an implant in there that looks good. Because
again, that depends on what your idea of looking good is.
Right. So, or looks natural. So I think that depends on what you're trying to get out of your breast implant exchange. When you remove that entire capsule, which we do sometimes for these capsular contractures, ultimately those people can have really loss of the pocket, and it's becomes really problematic in that situation to try to put the implant in and make it stay where it's supposed to be after you remove the capsule, which is basically
holding it up,
holding everything there.
Yeah.
So that gets complicated too, and I've even used grafts in those situations. So,
yeah, and a lot of surgeons, well, maybe not so much anymore, but it used to be quite common for surgeons, especially if someone was wanting to downsize, to take the implant out and wait 3 to 6 months before putting a new implant back in to allow the pocket to heal down on its own as much as possible.
Which is not a bad idea.
It's not a bad idea, and we have had several patients where we have encouraged them to maybe just take their implant out. If what they were thinking in their mind was possible with downsizing, like, let's just take your small implant out and see how you feel.
Right.
Like, you might not actually need an implant anymore. Especially 10 years on.
I know it's not like a large number of people, but most of those people don't ever do anything in the future.
Not as,
which is so
in
funny.
our office, not a single one has.
Yeah, I know.
Yeah. But your breasts change, and
Yeah.
you can grow more breast tissue, especially women who, I mean, even though FDA has approved.
Are you going to start talking about the mayonnaise? Didn't you talk about mayonnaise makes your breast grow?
Oh, no, that was the myths. Yeah, that was myths.
Do you remember that?
That was actually from an 80s movie. Yeah. So as you age, especially women, even though FDA approves breast augmentation for silicone breast augmentation for women over the age of 22, that doesn't mean your breasts are done growing. And especially if you have, maybe you start birth control or you stop birth control, like all of these hormonal shifts can trigger increased breast tissue growth. So you may find that, you take your small implant out that you thought you might want to downsize a little and you're happy with how your breasts look. You never know until you take it out, until you try.
Because you remember an implant, okay, contrary to common myth, does not lift your breast. Right, Amy?
Nope.
Okay, maybe subglandular or above the muscle a little bit, but not really. So most of the people over their lifespan, not most, but a lot, will present really with droopiness is the problem, right? And that the secondary problem is volume if you already have an implant or asymmetry or capsular contracture. So, some of these people, we'll take them out and we'll just do a lift alone and not put implants back in. And sometimes that's the best option. In the old school way, we would never do a mastopexy aug together. They would do the mastopexy first and then an augmentation afterwards. I'm talking about like in the 80s and 90s. And then clearly patients were like, well, this is complete BS. I'm not doing 2 surgeries.
Yeah, recovering twice. This was stupid.
So, and Amy and I definitely try to avoid 2 surgeries, but there's some people that are so complicated that it's almost better for them to take it out, give it 3 to 6 months, let everything heal, and then put the permanent implant back in. And that's especially true if you really want to downsize. That would be someone with super large breast implants and severe ptosis or severe droopiness, really unhappy. They just look distorted. You take the implant out, you maybe do a lift at the same time, let them heal, and then come back and put an implant in later on at 3 to 6 months. But that would be an extreme case.
Yeah. And that's the thing with your implants, they're not a lifetime device, as we've talked about before. You can exchange them. If you take them out and want them back in 5 years later, that's totally fine too. Or a year later, you can have them again.
In most cases, a breast implant exchange takes me less than an hour in the OR. In most cases.
Very rare that it takes more. If it's a breast implant exchange only, it definitely doesn't. It takes 30 minutes.
Yeah, probably do it in 30 minutes. And you could do it with IV sedation if you had the right surgeon and anesthesiologist. Quick recovery, be back on your feet really quickly. So in most cases, people, this is like one of the easier surgeries we do. But just like everything else in plastic surgery, it's not always easy.
Well, that's just like the human body. Bodies are weird.
Yeah.
So thank you all so much for listening to this episode today.
We keep showing me at the end.
Yeah,
me.
That's you.
Yeah.
Would love it if you'd leave us a voicemail. We have some great previous episodes where we answer questions from viewers and listeners. So we love listening to your voicemails and answering your questions. You can leave us a voicemail at 303-630-9038. And you can find us on social media at Jason Martin MD and at Beauty and the Surgeon Podcast. And we would love it if you leave us a like, comment, a rating, a review, share us with your friends. All those things really they are meaningful to us. And we do hope that this podcast reaches people who need this information. So
it only took us 117 episodes to do implant exchange. Probably one of the most common surgeries.
We've talked about it a lot. We've just never given it its own spotlight.
But why is that? That's weird.
But that's why, because we've talked about it a lot.
Okay.
And we just, it just needed its moment in the spotlight. Time to shine, breast implant exchange.
Shine. Mm-hmm. This is your time.
Without any other weird complicated stuff or BIALCL or anything else complicated.
All
Fat
that
transfer.
Stuff over there.
Just implant exchange. It's a real thing. Just do it.
Yeah, just do it.
Yeah. All right. Thanks, everyone, so much for listening.
Thank you.
Don't forget to check out our sponsor, Let's Get Checked. Let's Get Checked offers fast, affordable, and completely confidential health testing for everything from STDs, male and female hormones, and even COVID-19, right from the comfort of your own home. And remember, new customers and listeners of our podcast get 20% off by using our URL, trylgc.com/beauty, and be sure to use the code BEAUTY20 at checkout. That's trylgc.com/beauty and use the code BEAUTY20, beauty, BEATUY 20 at checkout. Get checked. It's the right thing to do.